Hello, folks. Hello, fellow board members. Hello, whatever, people, staff.
Hi, David.
I love you.
Good evening, everyone.
Hello. Hello, David. Hello, James. Hello, Patricia. Hi, Lucy.
Hi,
And there's
Angie.
James Keeler.
Hello.
Yep.
The man with the numbers.
That's right.
The ever
And then there's-
faithful Jim Powers. Have you ever missed a meeting, Jim?
I think when I was ill, I did, but other than that, no.
It's been wonderful.
Hello,
And
Bob.
The
Hello,
two
everyone.
windows in my wife's office here reflect a continuing sunlight due to, of course, the daylight savings times change.
Yes.
Which
Isn't
is
it
that
wonderful?
You have been-
is getting less popular, or should I say, more unpopular each year.
Well, I just read somewhere where the Senate,
Yeah, the Senate
Senate.
approved it. The Senate just approved it
to make it permanent.
year round.
Now, who's Senate, Illinois or US?
US.
US.
Really?
Oh,
Interesting.
Okay.
I never get the buttons right. All right.
Which buttons are you shooting for?
Trying to get everyone on the screen.
Is there a way to
There we
get
go.
everybody?
I think I have now.
Mr. Powers, can you see everybody?
I can see, 12 people. But I can't see any more unless I switch my screen and
Yeah,
pull it over.
you
But
go
I
over to
can't,
the,
I can't get everybody on there.
yeah, there's a view button up at the right upper corner. And if you have that on gallery, you should be able to see everybody.
Well, it's 6:30, so why don't we get started?
Okay,
Have we any guest or public participation?
No guests today.
No guests. May I have the approval? Someone make a motion to approve the agenda of March 15th?
I
So
will so
moved.
move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Opposed? May I have a motion to approve the minutes of
So
February
moved.
15th?
So
Second.
moved.
Any discussion? All in favor?
Aye.
aye.
Opposed? Peter, I guess you're on to talk about COVID, or James? Oh, Peter is, I'm sorry.
Yes, thank you very much. I'll give you a brief update this evening. This is page 9 in your board packet. I'm going to go ahead and share my screen as well. We'll just walk through this. Let me know when it comes up.
It's up.
Okay,
up?
thank you. So there's just a couple major points I'd like to highlight this evening. One is that, you know, we've come through that massive upsurge that started in January. And so if you take a look at the two charts on the left, the one over here, the cumulative cases, this shows since the beginning of time, and as the cases have increased, and you can see the first big surge, second surge, and then this really steep surge was the January huge increase that we had. And then you see the top of it starting to flatten off. That's cumulative looking at cases that we've had. If you look at the chart just below it, it sort of is looking at a case, average number of cases over time. And again, you can see the magnitude of the spike that came in January. It was almost a straight line up. We bounced around at the top of that, and then it's been coming down steadily since. This all reflects on the transmission levels. And so the other thing I'd like to, just sort of remind everybody is that the CDC changed how they're reporting out about COVID now. They've gone to a new model that is not focused on transmission rates, and it's now looking, come over to the right, upper right-hand corner, on Illinois community levels. This is also discussed in your board packet in a couple spots where they talk about this, if you get a chance to see it. But really, it's looking at, instead of looking at things like infection rates and positivity, or it's less reliant on that, and it's really looking at new cases per 100,000 and looking at the impact on hospitals, both in terms of admissions to the hospitals and that whether the hospitals are and staffing levels at the hospital relative to COVID. And so, as you can see in here, most of Illinois is green by this new standard. And this lines up with the changes in the CDC guidelines and the changing in masking and things like that. So when we pulled this together for the market rates, if you remember back a couple months ago, we were up around 800 cases per 100,000. Earlier this month, at the beginning of the month, we were at 61 cases per 100,000. As of today, we're down to about 50 cases per 100,000. So that drop has continued. The ICU capacity, which is this chart here on the lower right, we've, as a region, the hospitals have really been stressed. They've been below that 20% threshold throughout much of when we hit the peaks, the initial peak and then the one in the fall. Things got better for a little while, and then capacity really dropped. You can see that. On February 28th, it was actually at 20%, last day of last month, which I'm technically reporting on. As of today, we're at 19%. But so the hospitals are still stressed, but not quite as impacted as they had been. The other piece, this is the new, we've gone from a daily report to a twice a week on Tuesdays and Thursdays. We're doing a report out. Again, you may well have seen this. We're looking at the number of people who are hospitalized. We're looking at the overall vaccination rate. And then we're using surveillance data from the state on ED visits for COVID or COVID-like illnesses. And so what this graph is charting, the actual it's counting the visits, that's the blue line, it's bouncing up and down. Again, there's our January spike. And then there's sort of an average line that runs through that. And so we're using these as an indicator of the levels of COVID in the community.
And Peter, those are the EDs from our 3 hospital systems.
Yes, yes. Those are those are our hospital systems that are reflected in this. So these are all local data, but so it's not only Winnebago County residents, but it's the hospitals. It's our hospitals here. And the other thing that I would just call is the last bullet point up here is that the health department's vaccination clinics, that we ran for many months and served so many people were discontinued at the end of February. And that's the COVID data update that I have for you this week.
Thank you, Peter. Report to the Board of Health for February. Dr. Mattel, is that you?
Well, again, we kind of in coming back, we have the report, and so we're welcome to entertain any questions as the board has read through, if they want some additional, a deeper dive on any of the topic areas.
Are there any questions? Apparently not. Pat, you want to do the president's report? You're muted, Pat. Pat Lewis.
Pat, you're on mute.
She's working on it.
I was having trouble unmuting,
Sorry.
and I don't have anything to report.
Okay.
That's okay. I know it took longer to unmute than it did to say that, but I apologize.
No problem. Committee reports in regards to the executive committee, I'd like to have a get together of the four of us sometime in the next 2 to 3 weeks. Informal, some type of informal gathering. No agenda at this point in time. That's all I had regarding the executive committee. Finance, Dr. Williams.
I unfortunately, well, not unfortunately, I had a great time. I was out of town, and and the meeting was ran by John for me.
Oh, I thought you'd take it over, but we can do this.
We'll help you. We won't let you.
All right, well, let's see. Give me half a second here as I pull this together. And Jim, why don't let's see. First order of business will be approval of minutes for the March 9th, 2022 meeting. Do I have a motion to approve?
So moved.
So moved. Second.
Thank you. Motion in a second. All in favor?
Aye.
Aye.
Right.
All right, minutes are approved. We will move in. I will defer the financial statements and the information. Turning this to Jim.
Okay,
Thank you.
I'm going to share my screen. Do you see what's up there?
Yes.
Okay, all right. The first one is a resolution of expenditures, the one that we vote on. So I'll say it out loud here. Be it resolved that expenditures for the Department of Public Health be paid for the month of February 28th, 2022, as indicated above, in the amount of $708,008.29. Would I have a motion to approve?
So move.
Second. Any discussion or question?
We will need a roll call vote.
Okay. All right.
And so I'll do that now. Angie Gorel,
Yes.
Ron Gottschalk,
Aye.
Dr. Halverson,
Approve.
Dr. Helen,
Approve.
Lucy Hoover,
Approved.
Dr. Lewis,
Yes, I.
Robert McCreath,
Approve.
James Powers,
Approved.
Dr. Williams.
Approved.
Motion passes.
Okay, I'll move on to the fund balance here. For the month of February, we had $693,043.20 in revenues, and then the same disbursements of $708,008.29. So as our recap, we started with a fund balance of $10,093,153.96, with year-to-date revenues of 412, 546.51, and year-to-date disbursements of 4,387,721.40. So our ending balance is $10,117,979.07. So that's an increase for the year of $24,825.11. So I'll move on here to let's see. Okay, this is our financial review for the Board of Health, because we're already in the 5th month of our fiscal year, and then actually 2/3 through the Illinois fiscal year, where most of our grants are. So our budget should be year-to-date $4,533,201, and our actual is $4,411,648, with a variance of $121,553. And for expenses, our budget was $4,491,436, and then our actual and encumbered were $4,387,721.40. So a variance of $103,715. So we're very close to our budget numbers, but I just thought this would be a good time to bring up at the next Finance Committee meeting. I'll be putting forth an amendment, because we've had an extension of our contact tracing grant. We've had an extension of the mass vaccination grant. We've applied for a technical assistance grant, a mental health grant as well, and a RISE grant, and we've also had increases for sustainability in our COVID, in our DOT program, or our state opioid response, and in our substance use prevention recovery program. So there's a lot of changes, a lot of increases. So there'll be increases on both sides, both expenses and in revenues. So I'll move on then to the balance sheet here, which has all the cash accounts, and then our due from grantors right here is, I think it's a little bigger so you can see it, is up to $2,177,000. So I'll go through that whole schedule in detail. And then our fund balance here is down on the bottom. So, and then payables, and then our deferred amount here for $695,000, which represents an advance from the mass vaccination grant and an advance that we're working off on the local health protection grant. So if there's no questions, I'll move on. And then this is our year-to-date revenues and expenditures. We're still we're looking for an uptick in our food service permits. I'm told they're going to start to come in more rapidly. We only had about $15,600 for the month of February, but you know, the renewal time is coming forward. So and the totals down here are, again, the $693,000 in revenue, and then 708,000 in expense, and our year-to-date amounts over here. So is there any questions on this at all? No? Okay, I will move on then. This is our emergency reserve minimum graph. So Dr. Helverson's favorite here. And we are below $8 million here. We kind of running very similar to we were the year before. So we're fairly consistent. We've had some things that I'll point out here in a minute on the next report. So this is our accounts receivable here, which I've set over here in the corner. I've got like $2,177,000 in receivables. So that's kind of high for us. But these items in bold green here, there's about 525,000 we've collected since, in the month of March. So they've already come in. And this item here in orange, which is kind of sizable, they skipped this payment, so I've got them looking into that. It never reached this, so we'll get to that. And, so essentially, it's just it's nothing of concern, but certainly, that's what we monitor. So because we'd like to get our money from the state and the federal government as soon as possible. No reason to wait. And then down below here are, because of our advances, we have 607,000 that in performance that we're going to do in the population or the mass vaccination program, and then 88,000 here in services owed under the local health protection grant. So I think.
Jim, I have a problem or a question
Okay.
regarding real estate tax provision. What does that consist of?
A state tax provision?
Real estate tax
Oh.
provision,
Okay.
60,000.
All right. Where are we seeing that? Okay.
This the number 60,000. It's the first one at the top. It says real estate
Oh,
tax.
yeah,
provision,
okay.
215.
That is, that's our real estate levy that we collect. And I'm spreading that out by the month, but we collect over the year, the county assigns to us from the total levy, 2,585,000. So we collect approximately 215,100 a month. So I'm just
That's
kind
good.
of recognizing the revenue each and every month so we can try to smooth out the revenue and expenditures. So,
Okay, thank you.
all right. Okay, and that's it for the statements. So, Dr. Halverson, if you want, I'll stop sharing then.
Thank you, Jim. I appreciate that.
Okay.
Did we have any questions concerning the bank reconciliations? The information is all there. It follows as we have monthly. Do we have any questions or concerns about those? If none, we'll move into major expenditure requests. For March, we had 4, one for electronic filing fee for death certificates, one for a website redesign, something with Qualtrics Limited Liability Corporation, and one with a University of Illinois. The Finance Committee approved a motion to advance all of those to be approved or to be brought before the board. So I will request a motion to approve those.
So moved.
Second.
We have a motion and a second. Does anyone have any questions concerning any of those?
I do.
Thank you.
3A. Can you explain to me what that's about?
The filing fee for the death certificates?
Yes.
Yes, that's a monthly expense, which is the public's requests for copies of death certificates, either during that period or for something before. It typically runs, I believe, somewhere between $7,000 and $9,000 a month. It's, I don't know the exact amount. I believe it's $3.40 per certificate requested. Jim, you can correct me on the number, but that is a monthly expense.
Okay. Thank you.
Like to
And
call
it doesn't
for a
mean
roll
that
call
many
vote?
people, it doesn't mean that many people died. Sometimes
No.
people ask for 10,
It's the
12.
number every time we.
Yeah.
Thank you, Dr. Williams. Yes. If we have no other questions concerning any of the major expenses, we will need to do a roll call vote for approval. Christina, I will.
And yes. Angie Gorel,
Yes.
Ron Gottschalk,
Aye.
Dr. Halverson,
Approval for all?
Dr. Helen,
Approve.
Lucy Hoover,
Approved.
Dr. Lewis,
Aye.
Robert McCready,
Approve.
James Powers,
Approve.
Dr. Williams.
Aye.
Motion carries.
Thank you, Christina. I do not believe there are any other major expenditure requests, so we will move into proposed contracts and agreement. There is one, we did not discuss this at the Finance Committee meeting, don't believe. And this is the Illinois State Board of Education, a health inspection agreement. This is a existing agreement in the amount of $131,000, $131,250. Do I have a motion to approve?
So moved.
Second.
Thank you. I have a motion and a second. Do we have any questions concerning this agreement?
This is the summer food inspection program that we do in collaboration with the State Board of Education. And we also partner with other health departments. So we are the organizing entity for other local health departments in Region 1. So we've been doing this over the last 3 years.
Thank you, Sandra.
I'll take a roll call vote. Angie Gorel,
Approved.
Ron Gottschalk,
Aye.
Dr. Halverson,
Approve.
Dr. Helen,
Approve.
Lucy Hoover,
Approved.
Dr. Williams,
Approved.
Robert McCreath,
Aye.
James Powers,
Approved.
and Dr. Lewis. Did I say you?
No, you
Thank
didn't.
you.
Approve.
Thank you. Motion carries.
Thank you. And I believe that is it for March's Finance Committee.
Hey, thanks, Jeff.
Thank you. Thank you, Dr. Williams.
Thank you, Jim. Jim and Jim. Moving on to Policy Committee. Ron?
First thing we need is approval of the minutes of our March 9th meeting.
So moved.
Approve or second?
Any corrections? Do we need a roll call vote on minutes? No?
We didn't on the last one, mostly just for the major expenditures and agreements, anything that.
I know Rafa's not on tonight, but Charlotte, do they have to do a roll call vote on the minutes?
Well, technically you should, yes.
All right, thank you.
So that means our agenda wasn't approved properly.
Well, we're moving forward, doing it the right way.
So I will call a roll call vote. Angie Gorel,
Yes.
Ron Gottschalk,
Aye.
Dr. Halverson,
Aye.
Dr. Helen,
Approve.
Lucy Hoover,
Approved.
Dr. Lewis.
She's muted.
Aye.
Robert McCreath,
Aye.
James Powers,
Approved.
Dr. Williams.
Approved.
Motion carries.
Second thing on that we took up was the proposed fee for supportive testing. We didn't come up with a plan for you to consider tonight. If Todd wants to explain what we're looking at, but we're also going to look at it again in April to try and come up with a little better process on how to handle it if we can. Todd, did you want to just quickly explain it?
Yes, Chairman. Yes, for in your packet, you do have some background information regarding this proposed fee. In the background, I just wanted to say what we have authority on what type of water systems. And one of them is the non-community water system, which serves schools, factories, churches, gas stations, all that kind of thing that are on a well. They're not on public water at all. So they're out in unincorporated areas of the county. We have 138 of them. We do get reimbursed from the state, but that reimbursement has not changed for probably about 30, 40 years. So it's really truly to get a better handle on the overall program. What I mean by that is improve public health and actually taking over the oversight of every year of this program. We do sampling every other year, but the 138 of them do it the other following years, in between those years. We want to do it every year
not only doing the water samples that we do and what they do, but also the surveys, sanitary surveys, which looks over the well itself, the components of the well, and all that. So the main basis of what I'm trying to do is get a better oversight and supervision so we can ensure public health for our residents in Winnebago County, but also make up the deficit to cover our costs of doing this program.
Committee is going to be looking at that again in April and hopefully bringing something to the board for them for their consideration. The next item is the resolution which the committee is bringing for approval to the board, the Strong Communities Grant Resolution to approve Illinois Housing Development Authority. The wording's a little strange, but Charlotte, could you speak to that or not?
Todd can probably speak to that better.
Okay.
Yeah, this is one of the grants that is taking over the APP, the Abandoned Property Grant that so we can address demolitions. IDA has no longer provided funds through the abandoned properties, and they have switched over to the Strong Communities. So this resolution gives the authority for Dr. Martell to sign off on all documents and stuff like that moving forward. That's what this resolution is. I'm excited that there is another avenue of funding to address demolitions. So we'd like to.
Yeah, it's a resolution that has to go to the county board to give me the authority as a as a governmental entity to sign off on behalf of this grant. And we've done it before when it was the abandoned properties, but now that they've changed the titling on it, we have to go back and have it approved as well. So what you see before you is the resolution for the county board to consider.
So basically it's your recommendation to the county board.
Yeah, to pass it through. Yeah. Thank you.
Okay. So the policy committee is recommending to the Board of Health to recommend to the county to recommend, no, that's it, I guess. The resolution as set out. Any questions or discussion else?
Yes. Dr. Martell, doing this, will that also help us move the demolition of those abandoned properties faster?
Not necessarily, Angie. It's basically a continuation of prior programs. Again, the APP, the Abandoned Properties Program, we were in round 4, ending up and applying for round 5. They now call it the Strong Communities. So this is the grant we've always managed and held to address that. It's what we need to do is be able to have the authority now to continue the program. So it's one of the several programs we have.
Okay, thank you.
Any other questions, comments? Okay, we need a roll call vote on the recommendation from the policy committee to the board for its recommendation to the county to approve or carry out this resolution. Nina.
You're on mute, Christina.
Christina, we're going to vote.
Roll call vote, Angie Gorel. Angie?
Yes.
Can I get your vote? Yes. Ron Gottschalk?
Aye.
Dr. Halverson?
Approved.
Dr. Helen?
Approved.
Lucy Hoover?
Approved.
Dr. Lewis?
Aye.
Robert McCreath?
Aye.
James Powers?
Approved.
Dr. Williams?
Approved.
Motion carries.
Okay, the next item of business from the policy committee, which we have approved to bring to the board, is the changes to the mitigation policy. Now I got it right. Charlotte?
Right. So the changes to the medication policy and also the vaccination policy that'll come up next are basically 3. The first thing is we just want to clarify that for employees to be fully vaccinated means they have to be up to date on all vaccines and recommended boosters. The second thing is, as Peter mentioned, they changed basically the metrics for the county from community level or from transmission level to community level. So we want to be clear for the employees that are required to test that it falls under the community level. So now that they're only required to test once a week versus 3 times a week, which they probably still would be under the transmission level. And then the final thing is there's still requirements to mask, social distance, and test. In the policy, we just want to give, or asking to give Dr. Martell the authority to, in her discretion, change those or waive those as COVID changes, so we don't have to keep bringing the policy back to the board.
Okay, so Charlotte has explained the changes to both policies, but we will vote on each policy separately. And again, the committee is recommending approval by the full board for the mitigation policy, and that would have a roll call vote for the mitigation policy.
Yeah.
Roll call vote, Angie Gorel,
Yes.
Ron Gottschalk,
Aye.
Dr. Halverson,
Approve.
Dr. Helen,
Approve.
Lucy Hoover,
Aye.
Dr. Lewis,
Aye.
Robert McCreath,
Aye.
James Powers,
Approved.
Dr. Williams.
Approved.
Motion carries.
Okay, so the vaccination policy, you had that explained as far as the changes that were made. So unless there's further discussion or questions, and we need a vote on the vaccination policy as amended.
I think you need a motion in a second.
It's coming from the board, so it doesn't have, it's coming from the committee, so it doesn't have to be moved and seconded.
Say that it came from the committee.
A came from the committee, it says, not A and B.
I believe there were some procedural concerns with what happened at the committee level. So we, just to be safe, like to have a motion in a second.
Oh, okay. I move.
Second.
Okay, so then I have a question. What were the procedural questions at the committee meeting?
Ron, in reviewing it, the challenge that we have is that there were, I believe, you chose not to vote at that level, on that particular policy. Mr. McCreath is an ex officio, and we had Lucy Hoover voted, and we had one, and then Jennifer Moraski voted no. So, and technically, we could not count Mr. McCreath's vote based on the understanding of Robert's rules. And since you did not vote or not abstain, we have to re-vote. We have to bring it to the entire board.
Okay, so we have a motion and a second.
Yes. Roll call vote. Angie Gorel,
Yes.
Ron Gottschalk,
Aye.
Dr. Halverson,
Aye.
Dr. Helen,
Approve.
Lucy Hoover,
Approved.
Dr. Lewis,
Aye.
Robert McCreath,
Aye.
James Powers,
Approved.
and Dr. Williams.
Approved.
Motion carries.
That's it for policy.
Thanks, Ron.
Welcome.
Personnel, there was not a meeting.
No report.
Quality, Pat.
Sorry, Pat.
Every time I think I'm ready, I'm not ready.
That was not bad.
Quality met tonight. We continue to sort of dive back into quality and performance improvement and get our brains back in gear. And it looks to me like Peter is going to do a little more of an update on reaccreditation. So you can take it, Peter.
Thank you. All I was going to share is basically that, again, you have in your packet on page 116, the feedback we received from the Public Health Accreditation Board on our submission of our 2021 annual report, section 2. We reviewed these findings and recommendations with the Quality Committee this evening. And that led to I think, a very productive and robust discussion about performance management and quality improvement. I'm not sure if we need to review those, if you want to review those comments with this group tonight. They're in the packet. The feedback generally was that as you're getting your performance management QI initiatives really back on track coming out of COVID, that there's opportunities to do training and to make sure that people and staff are online, to make sure that you've set up processes that invite and allow for feedback, and then had some recommendations relative to some educational and training resources that are out there. There was some positive feedback on some things we called out to the accreditation board in our annual report, and unless there were any questions, that's the gist of what we did review and cover. Thank you.
I think to add to what I said in the beginning is that we are all going to be reviewing the new accreditation standards, trying to make, the committee will review those, trying to think about what that means for our reaccreditation efforts. And we're going to get our brains in gear. There's in the recommendations that we got from the FAB, there were recommendations on retraining staff or bringing staff up to date. And I think we decided that we also needed that. So we'll be doing that. And when we can bring you a better picture of where we are with the reaccreditation, we'll bring that to the board. I think
All right,
that's all for us.
Is there any new business or other matters?
There's not.
Dr. Mattel, do you have anything to say regarding correspondence and information?
No, I do not.
Okay. Do we need an executive meeting?
We do not.
Someone make a motion, we adjourn?
So move.
Second.
Second.
All in favor?
Aye.
We
Opposed?
need to do a roll call vote for that.
Yes. Angie Gorel,
Yes, aye.
Ron Gottschalk,
Aye.
Dr. Halverson,
Aye.
Dr. Helen,
Approve.
Lucy Hoover,
Aye.
Dr. Lewis,
Aye.
Robert McCree,
Yes.
James Powers,
Yes.
and Dr. Williams.
Yes.
Motion carries.
And we are meeting
Is there
in
any
person.
discussion? If not, we have adjourned.
Oh, wait. Yes, but we are meeting in person next month, correct?
Correct. That is the plan. And we plan to meet our committees as well as our Board of Health meeting in April in person. And again, we have invited the chairman to attend our April meeting in recognition of Public Health Month.
I recommend name tags. I'm not sure I'll recognize any of you in person.
You haven't aged that much, John.
No,
John,
it's perfect to
you may have
recognize.
forgotten.
Thank you, everyone.
Thank
All right,
you.
everyone have a
Thank
great
you.
St. Patrick's. Take care.
Yes,
Night,
happy
everyone.
Aye.
Forward to seeing you all.